are recommendations for improving mental health counseling at Resource Center Dallas. I'm Mary Catherine, this is Eugene, Jenny, Rafine, and Divya, and we're glad that you could join us today. We chose the team name Kairos because it means the opportune moment or the time when conditions are right to accomplish a crucial action. We believe Resource Center is at this opportune moment in terms of growth and change. Thursday, Resource Center broke ground on a new building that will house many of its services, including mental health counseling. We had the opportunity to attend that groundbreaking ceremony and see the support and momentum firsthand surrounding Resource Center.
We would like to give you a background about the Resource Center. The Resource Center was founded in 1983 and is one of the largest LGBT centers in the nation. Just to define the acronym LGBT or LGBTQ for you, it's lesbian, gay, bisexual, transgender, and questioning people. Resource Center was initially founded to combat harassment from law enforcement and unequal status under the law. After its first year, it focused on AIDS screening and treatment because of a growing concern because of the AIDS epidemic, which began in 1983. Recently, Resource Center has reinforced its services for the entire LGBT community as a whole, and will continue also with its AIDS services. These are some of the other services that they provide. Youth First is for youth ages 14 to 22. Gray Pride serves senior citizens, and both organizations are the only local LGBT-focused programs. They both aim to combat isolation and improve mental health by providing social interaction and counseling in a safe space. One of the things that makes Resource Center really stand out from its competitors is its cultural competency training, and that training prepares their interns to provide care with cultural sensitivity. The new location of Resource Center, which Mary Catherine spoke briefly about earlier, is at Inwood and Cedar Springs, conveniently located next to a very large LGBT church and also very close to a medical center. This new location has a partnership, as well as the old location, will have a partnership with SMU School of Education and Human Development, and this partnership originated in 2008. SMU currently provides 4 student interns from the Master's in Counseling program here, as well as a program director that oversees all of these interns. There's a potential at the new location to have up to 8 to 10 student interns because of the increased space, as well as potential new clients. Currently, SMU's 4 interns provide 1,600 annual counseling sessions to about 250 clients who are children, teens, and adults. And individual therapy is the modality most used currently.
There's a great need for the Resource Center services in the LGBT community. The road for LGBT rights in Texas has been a rocky one, but with the pending Supreme Court case regarding gay marriage gaining nationwide attention, things are looking up. Texas even saw the first in-state gay marriage this February. However, LGBT individuals still suffer extremely high rates of depression and anxiety. This is the opportune time for Resource Center to make their mental health services known to the community. Resource Center is the safe haven that LGBT individuals seek in order to find support, to know they're not alone. Resource Center is also a great place for people to seek acceptance of their peers and to feel more comfortable in their own skin. Many LGBT community members feel uncomfortable in traditionally based mental health services. Resource Center strives to help fill the void of LGBT-focused mental health. Resource Center needs this mental health program expansion in order to help better serve the community that's intertwined in their very foundation. By expansion and enhancement, Resource Center can help more clients and ultimately fulfill their mission to empower the LGBT community. The Resource Center's objective is to double the clientele currently utilizing their mental health services. As of now, Resource Center serves 250 clients in their program. Our charge is to help Resource Center reach their goal by creating an innovative strategy that is easy to implement, revenue generating, and of high quality. We recommend that Resource Center hire 1 full-time staff member that can meet client needs and rebrand their mental health and counseling service line. These first 2 recommendations provide the foundation for our 3rd recommendation, which is to build partnerships with churches, schools, nonprofits, and internal units. Ultimately, these recommendations will lead to a growth revenue for Resource Center.
Inherent of all these recommendations we give to Resource Center is the leverage of the current strengths that Resource Center has. And we've identified 4 key strengths that they have. One is the cultural competency training programs that Resource Center go through. 2 is a strong presence in the local LGBT community. Resource Center really focuses its energies on rebranding, because with rebranding comes a greater association with the high quality care that Resource Center already provides through its cultural competency training programs. And with that comes greater interest from wealthier clientele and word of mouth spreading among that clientele. And with that comes the shift in perception from Resource Center only serving the low income people to those who just want the best medical care in general. And with that comes greater revenue, which makes business financially sustainable, and thus the Resource Center can have a greater ability to do more pro bono cases in order to greater serve the community that it wants to serve. And so here's just a couple of examples of what we recommended. Really, they focus on utilizing the existing capital in the maximum way. And so on the website, we want to emphasize that the cultural competency strength should be advertised widely, because that is definitely something that can be leveraged. In addition, because the new building is so modern and so appealing, that definitely should be more accessible on the homepage of the Resource Center website. In addition, Resource Center should pursue a very robust social media campaign. As we went to the groundbreaking ceremony, we saw that they were already starting the campaign. But they also have 1,300 volunteers and 55 staff and so many donors. They have such wide human capital that they can really get the word out there about the mental health care through their Facebook, Twitter, and maybe even Instagram accounts, and have a hashtag campaign, such as hashtag MyRC, to really increase the number of clients served.
And so after building on the foundational basis of what scaling will take, 1, qualified staff, and then 2, changing the perception of Resource Center specifically for attracting high net worth or at least middle class clients, we recommend that Resource Center engage in partnerships that are collaborative in nature with churches, schools, nonprofits, and internal lines. And so there's a lot of chaos around partnerships. They're tough, they're sticky, it's tough to get everyone on the same page. What we try to show with this map is that there's a lot of opportunity, both horizontally and vertically, for Resource Center to partner with organizations. So for example, if an organization works with the LGBT community but doesn't currently provide mental health counseling services, we recommend that Resource Center approach that nonprofit to allow for referrals. Conversely, if a provider deals with mental health counseling but doesn't have specialty or cultural competency in the LGBT community, we once again recommend that Resource Center approach that nonprofit. And we think this can be a very mutualistic relationship. And so throughout our time, we've done a lot of work dealing with potential partners, including Cathedral of Hope, which is just a stone's throw away from the new Resource Center location. And there does seem to be both interest and a potential market for these partnerships to occur.
Churches are deeply embedded in a community and serve as an anchor for its members. Cathedral of Hope is a great potential partnership due to its influence in the LGBT community as well as its proximity to the Resource Center's new location. Schools are key for expanding to the teen and youth client base. Resource Center can scale their marketing efforts to schools by communicating with local counselors and publicizing their counseling programs to students as well as their parents. Nonprofits can help create awareness for Resource Center services. Many nonprofits do not have a mental health line, and so by partnering with these organizations, Resource Center can increase their client base. Resource Center can also benefit by marketing to their current client base who utilize their other services. This will lead them to integrate their mental health services into their overall mission.
And so finally we get to the juicy part, the part I know Marissa cares a lot about, which is revenue. How are we going to grow mental health counseling in order for it to first initially serve as a cross-subsidy and then to scale to a level at which it can both support middle-class clients but also pro bono clients, core to the mission of Resource Center. And so we see through churches, schools, nonprofits, and internal resource lines that revenue will grow. And the way it will grow is through partnerships, mostly referrals, but our biggest growth is actually, we predict, going to come from internal Resource Center lines. Resource Center has huge brand equity, as Eugene touched on earlier, And currently, Resource Center doesn't do any integrated marketing with its other service lines. There's very little communication between mental health counseling and the other units of the business, and we simply want to leverage that. But the best part about our proposal is that costs are very low. What we're recommending, partnerships, is a low-hanging fruit. And so rebranding is really social media work, some flyers. Partnerships is someone on the ground dedicated to building partnerships, or at least partially dedicated to building partnerships. The biggest cost is really going to come from hiring a mental health professional. The reason that person is so key is because you do not want to get people to come to Resource Center and then walk away because Resource Center isn't able to meet a basic service need. And an LPC, compared to the current intern class, can deal with a whole host of different mental health scenarios that Resource Center cannot currently service, and that's lost business. And so finally, what we're recommending is that Resource Center deal with its staff problem, deal with its brand rebranding problem through relatively low-cost means for high revenue gains. And we again emphasize that partnerships are highly critical for this to happen. Our team name Kairos, the opportune moment, shows that Resource Center moving to a new location, raising millions of dollars, seeing the optimism and the groundbreaking. This is really a time for Resource Center to continue to grow its organization. As Divya touched on, Resource Center has always strategically touched on what the LGBT community needs, and this is a need that isn't currently being met. And it can be met with greater collaboration with the Dallas social sector, which has worked so effectively for so many organizations, SMU, the school zone, and the Bush Institute.
Thank you.
Great, we'll now have excellent presentation. 10 minutes of questions from the judges.
So I have one. On the revenue, on the summary recommendation for revenue, you have build partnerships with churches, schools, nonprofits, and internal units. So it's a basic assumption to continue serving the same, primarily the same group, target group, and we generate more revenue by serving 500 low income who pay an average of 10 instead of 250? Was that?
So I would say partially.
Okay.
What we tried to really focus on is because the market eventually will saturate, and that's not good for scalability, is to work with a diversity of partners. So for example, a lot of us went to local Dallas high schools, and we saw kids, our friends that had come out, but then they would go to a school counselor or a school nurse, and the nurse wouldn't know what to do. And especially for low to medium income children, there was no outlet. And so I went to Richardson Independent School District, for example, and that might be a great opportunity for Resource Center to sign an MOU with RASD to say, if there's a mental health counseling need in this age category, send your students to us. And so schools are a way to grow age-wise. Nonprofits might be a good way to grow with non-traditional clients because 90% of Resource Center's business is currently LGBTQ, and 10% is non-LGBTQ. So we think those percentages can be tweaked a little bit. But you're right, our internal resource line play is really taking clients you currently have who use mental health services, but currently either don't know about them or aren't sold on the service.
Did you determine how many clients would be needed to kind of pay for the staffing and rebranding and partnership recommendations that you have?
Sure. You can also repeat his question for the
Sure. Do you want to flip back
Flip back
to
to
revenue? The question was, what's the break-even point in terms of headcount? And in our analysis, one more revenue. In our analysis, the break-even point is actually very low because total costs for the first year, the professional is going to hire rebranding efforts and the like will only cost about $40,000. And so the revenue you need, the headcount you need, is partially dependent on the number of hours that person will go to group therapy. Our model assumes a very conservative estimate of 30 hours per year. And so doing that math, you really only need about 1,500 hours total to make out that $40,000.
So that's how many new people walking through the doors?
The break-even point is about 200 people. Resource Center currently wants to double. Our projections show that it'll more than double if you take advantage of all these partners.
Okay, so 200 people paying full price will pay for the new
That's another good point. Another part of our revenue model is Marissa and I, we talked about this, is you're not going to get 100% private insurance. And so we estimate 30% private, 30% public, and 40% at cost, which is at cost of the resource center. And so that's the mix. And we actually talked to a clinical psychologist who runs a private practice, and we use the revenue he gets from private, public, and at cost. And we use those numbers because that's kind of the market rate in the DFW area for these services.
So I want to understand, go to the next slide. So you're suggesting one LPC hired full-time will take on 200 clients?
No, that we were just recommending a one LPC for continuity of care, but also expanding to 8 to 10
okay.
interns.
Thank you.
Because the work that interns do is invaluable, so that will help take care of all these new clients that we're anticipating.
And one thing we focus on in global health is task shifting. And so the interns actually have the ability to do a lot of kind of low to medium stream work, but they need some supervisory ability or some guidance on things like referrals, what's the next step with the patient.
If you go back to your revenue page, the link between the LPC that's being hired and the internal value, is that, could you talk a little bit more about that and where, because I think the question would be, if they're interns and there are others, what is the option of if you didn't hire and how much of this value would you capture? Did you guys think through that?
We believe that full-time LPC might help a lot with the rebranding and perception of the Resource Center program among clients. We believe that hiring someone who's full-time already received all of their intern hours after their licensure and everything might help clients understand that this is, the kind of service that they want to.
If I can touch on the financials of your questions, Harvey, if you could go back to the LPC slide where we do pros, cons, education level. The first thing is you look at the leakage rate. Essentially, I think what you're asking is patients lost. What services can't Resource Center meet currently? And so, like different types of depression, most mental disorder in the country, Resource Center can't currently deal with. So those are either patients that are turned away or referred to outpatient providers. We don't have a concrete number for you on what that value is, but we would estimate that it's greater than $37,500 for LPC professional.
Does this consider benefits? Because 37.5 seems
It's
like
low.
a low number if it includes benefits.
That's all I could find during my research for the median cost. It obviously ranges, and I'm sure there's.
And while we're on the cost page, so rebranding doesn't cost anything, is that right? Or
So we're just using existing capital already. As we mentioned, it was mostly focused on the social media campaign and maybe just slight website restructuring. But it's very minimal because the good thing is that we're kind of drawing on a new logo that Resource Center made about 2 years ago. And in addition, we're also drawing onto the new facility because it looks very nice. And I think that the facility and the new location will by itself draw a lot of clients. And so we need to really get the word out there that the location, the services that they're providing are really high quality, and just Resource Center itself, I think that's just really key in bringing more people in.
And a quick test of this, Jeremy, is if you go to Resource Center's Twitter right now, you won't see any mention of mental health counseling services.
I feel obligated to point out an error in the slide that showed the universities and what they offer. SMU offers a Master of Science in Counseling, LPC, and Marriage and Family Therapy, which you have TWU offering, but not SMU. So my colleagues would
That might have
hurt me.
been a glitch in
I know.
the technology between
okay.
sending it. We had some checkmark issues as well on there, but.
Just want to make sure it's accurate.
Thank you.
We hate to give them credit.
Give it another 2.5 minutes. If the judges don't have questions, more we can also ask the audience.
Please.
Are there any questions from the audience?
I've got one.
Yes, please.
So, it sounds like one of the things that you're looking for is to change the mix of clients. Tell me some more about what you're thinking there. I understand the going to the school system, I understood a little less about churches and nonprofits. How are you thinking about bringing in more clients that are able to pay higher fees or generate higher fees?
I guess a lot of the questions are around the revenue model, and so I'll take that one, Regina. Basically, yes, we are trying to change the customer mix, and so as Marissa pointed out, we're not trying to radically change that mix, and so churches like Cathedral of Hope currently serve the LGBT community, but some of the congregation at Cathedral of Hope is higher income compared to Resource Center's traditional service lines. And so when Marissa first consulted with us, one of the things she wanted to know is how can we change the customer base in order to make this a revenue positive enterprise. And to, I guess, further on to your point, schools, I think will increase more variation because you have great diversity even within the ISD in terms of income, and I think the same will happen for churches and nonprofits.
Who's the gentleman?
I was just curious if there was, so outside of kind of the traditional group that we worked with, was there any, was the thinking that the social media would reach other markets? That would be the primary way
Right,
to
so
reach
they're
people
actually,
in the middle that, all right.
Right, good question. So I found that on your website, and I think through some stats that you have 1,300 volunteers and 55 staff, as well as numerous donors, as I've definitely seen in the groundbreaking. So I think once you have that combined manpower, then you'll no doubt reach those that you're trying to reach as well. Actually, I tutor someone who volunteers at the Resource Center, and she's actually from a law family, and she's also a little anxiety-ridden. But I was also thinking, what if she was using her services? I mean, because she already knows about Resource Center, but if she was made aware, if she was encouraged to really send that out there and perhaps even go there herself and bring along her friends, I think it would be really awesome.
Thank you. Team Pyro.